Hi guys, my name is Mac Erjgus and I will be talking about the lesson 9 of our subject, which is the physical and health impairments. So first and foremost, what is physical and health impairment? So physical and health impairments are disabilities that interfere the academic and daily physical routine. So these impairments were caused by congenital abnormality, which is caused by some disease and other causes. The health impairment includes chronic illness and diseases. The examples of chronic diseases are diabetes, cancer, heart disease, arthritis, and etc. And physical and health impairments have different conditions and different diverse causes. As mentioned by CP or cerebral palsy, and spina bifida, which is when a baby's spine and spinal cord does not develop properly in the womb, causing a gap in the spine. Abnormal brain growth is one of the causes. Some are genetics, result of an injury, hormonal abnormalities, poisoning, and some are still not identified. So, in further studies are still needed to identify the direct cause of this disorder. To truly express its characteristics, identified characteristics includes limited movement, shortened endurance, adaptive equipment, and extra medical needs. So this is some of the diseases that we are about to tackle, which is orthopedic impairment, traumatic brain injury, other health impairments, and multiple disabilities. So the first one is orthopedic impairment. So orthopedic impairment, a severe orthopedic impairment that adversely affects educational performance. The category includes impairments such as amputations, absence of a limb, cerebral palsy, poliomyelitis, and bone tuberculosis. So the second one is traumatic brain injury. So traumatic brain injury, an acquired injury to the brain caused by external physical force resulting in total or partial functional disability or impairment or both that adversely affects a child's educational performance. The category applies to open or closed head injuries resulting in one or more areas, such as psychosocial impairments in reasoning cognition, language memory, attention, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities. Psychosocial behavior, physical functions, information, processing, and speech. The category does not apply to brain injuries that are congenital or degenerative, or brain injuries induced by birth trauma. So other health impairments. So other health impairments are health impairments include convulsive disorders, cystic fibrosis, heart disease, sickle cell disease, hemophilia, leukemia, asthma, rheumatic fever, cancer, AIDS, or any other chronic or acute health problem that limits strength, vitality, or alertness and adversely affects the student's educational development and performance. Multiple disabilities. So, multiple disabilities, a combination of impairments such as mental retardation, blindness, or mental retardation physical disabilities that causes such severe educational problems that the child cannot be accommodated in a physical education program solely for one of the impairments. The term does not include deaf blindness. So these are the examples of the general impact of impairment. So the first one is communication skills, the second one is mobility, the third is gross motor skills, the fourth one is speed, then the fifth one is strength, sixth one is vitality, the seventh is fine motor skills, and the eighth one is alertness. And these are the effect of the learning styles in the way the students in the way so this may affect the learning styles and the way students and how they view themselves. So and how to process information, learn self-help skills, and participate in the classroom activities, the students' memory, and on how they focus their attention and perception.
Okay, for school-based program, learners with physical and health impairments or traumatic brain injury need extra support from educators and health workers. Okay, interdisciplinary team of professionals to aid in all of their special needs, such as teachers and therapists. Actually, there are different types of therapies, like physical therapists. Okay, physical therapists is help them to their gross motor goals. Okay, next the occupational therapists to work on fine motor and help self-help skills. Then, speech therapists to work on any difficulty with language. This type of therapies that I mentioned, it can help. It has a big rule to the learners that has a mental health disability. Okay, is like physical therapies. Okay? It helps their to improve their gross motor goals. Okay. How about the speech therapies to work on any difficulty with language, because there are so many learners that has a mental disorder that are struggling to their language, how they talk. So, dyan papasok yung speech therapies. Okay. Okay, next, it is not all about the therapist, and let us not forget the one of the most important person. Sino man yon? Yon ang mga teachers natin. Okay, teachers can help or assist the children or the student. Okay, so that the student will learn to the teacher. Okay, teachers and therapists can help the child learn to take care of their own special medical needs to become more self-confident. Yes, itong dalawang ito, teachers at therapists, sila yung nag-a-assist sa mga estudyante na may mga special needs, okay, to improve and to become more self-competent. Okay. 45% of students with physical health impairments are educated in a regular classroom. Okay. A larger interdisciplinary team to assist students with physical disability with impairments and traumatic brain injury must be taken into account. Okay. Most of the student that has a mental issue or mental health disability, dapat merong mga merong mga person like teachers or mga special therapists na magfo-focus sa kanila. Okay? To assist them, to one-on-one assist them para makatulong. Malaking tulong talaga yung mga teachers or mga professionals, specialists natin na mag one-on-one doon sa student para yung student ay madaling makatuto. Okay? Instructor or regular education teachers must take account to keep an environment open for wheelchair and any other medical device to accommodate for the child needs. Okay. Okay. Listen. This is one of the most important. If the school has a program for the for the student that has special needs, it must important to secure na dapat na kompleto sa kagamitan yung paralan. Bakit? Kasi in case of emergency, dapat ready always ang paralan because itong mga special needs ng mga estudyante na merong mga special disorder or disability ay kailangan ng assistant. Hindi lang doon sa teachers or sa sa mga therapists, kundi doon din sa mga gagamitan. Okay, like wheelchair and any type of medical device to accommodate for the child's needs. Okay. Yan. Okay. If the if the school na may ganitong mga needs o mga device na kailangan ng ng mga bata na may special needs ay malaking tulong talaga. Okay, next, keep the child comfortable in their learning environment so they can focus on their education. Okay, tandaan, ang mga estudyante na may mental disorder or mental health disorder ay kailangan mo talaga kunin ang kanilang focus. Okay? Because yung mga batang ganito, madali lang madistract sa mga bagay-bagay, sa mga bagay na pumapalibos sa kanila. Okay. Keep the child comfortable in their learning environment. So, dapat comfortable ang mga bata para sila ay maiganyo at saka makafocus sa pag-aaral. Okay. Next, school-based program. One-on-one interaction to student with physical and health impairment are also suggested as the following. Okay, as what I say kanina na itong mga teachers at mga special professional mga therapists ay napakalaking goal nito para sa bawat isa. Okay, kung talagang gusto mo matuto yung bata, dapat kailangan mo na i-one-on-one talaga sila sa kanilang pag-aaral. Dahil kailangan mo talaga makuha yung kanilang gusto at focus para matuto sa isang bagay. Okay. Paano ba natin ito gawin para makuha ang kanilang focus? Okay. First, remove obstacle and arrange furniture to ensure clear passage over you will sit and conduct any meeting. Okay. Dapat malinis sa mga lugar. Dapat hindi magulo para hindi sila ma-distract yung mga bata sa pag-aaral. Okay? Next, consider an assistive device as an extension of the personal space. Next, remember that most power wheelchairs are controlled by handheld device and should be left for the individual to control. Okay, 'di ba maraming mga device na ginagamit yung mga tao na may mental disorder? Kaya dapat ito ay ma-secure at ma-manage talaga para makaiwasan ng disgrasya. Next, if a conversation is expected to last longer than a few moments, suggest an area nearby that is comfortable for all parties to be seated. Okay, ang ibig sabihin nito, kung sa tingin mo na yung topic or yung gagawin na conversation sa iyong mga estudyante ay matagal matapos, dapat hahanap ka ng mga comfortable na mga lugar tulad ng classroom, okay? Mga rooms na comfortable sila, para makaupo sila na maigi, maka ano sila, mm, mak, maka-listen sila ng mabuti sa iyong lecture, okay? Dapat malayo sa distraction. Speak directly to the person, not to an accompanying support person. O say pasabot ani. Okay. Ano ibig sabihin nito? Speak directly to the person, not to an accompanying support person. Hindi man sa lahat, no, pero most of student that has physical disorder or mental health disorder ay mayroon mga assistant. Okay? Kung 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 tuturo ka na sa kanila, alam naman natin na katabi talaga nila yung mga assistant natin. Okay? Kung gawin natin, kung tuturuan natin yung bata, dapat sa bata mismo tayo uusap, hindi doon sa person na katabi nila o yung assistant person. Okay? Next, if you are not sure what to do, ask. Okay? If sa tingin nyo yung bata hindi niya naintindihan or nalilito siya kanyang, sa kanyang pag-aaral, dapat sabihan mo siya na hindi siya mahiya or ano ba, na dapat marunong siyang humingi ng tulong. Okay? Or if you makikita mo siya na nahihirapan or sa tingin mo na you saw a person that is struggling to study, you should go there and ask if he need a help. Okay? Because what I said, teachers is the one should go and help the student that has special needs. Okay. And that's all for the school-based program about the special needs of person that has mental health or traumatic brain injury.